Let's turn now to Democratic Congresswoman Debbie Wasserman Schultz of Florida. She's the chief deputy whip in the House, and she knows what's going on. So, Congresswoman, I know you know more than I know. Share, how close are you to getting towards 216 by Sunday or later?
I think by Sunday, or when we vote, which I believe will be Sunday afternoon, we will have the 216 votes that we need to finally pass this historic reform and cover everyone in America, make sure that we provide some security and stability to people who already have coverage.
Why is the president not going to Indonesia on schedule? Have you been informed as a whip?
Well, I think it's pretty obvious why the president wouldn't go to Indonesia, because this is the most significant historic piece of legislation that we've ever considered, and short of Social Security and Medicare. And this is an opportunity to finally do what every president for the last 100 years has tried to accomplish, and we need Barack Obama's leadership. So we need him in the game.
Do you think the members who are making statements about why they're voting against the bill are giving true answers or answers that meet their expediency? For example, Stephen Lynch up in Boston, he's a Saudi representative from South Boston. He's just come out against the bill, and he says he's going to vote against it because of the cost issue. But I know he's a pro-lifer, and I wonder whether he just doesn't want to offend the pro-choicers in his district by saying that's the reason. What do you think?
I'm not going to question my colleagues' motivations for how they cast their vote. Everybody has their own reasons. And listen, we've spent a lot of time on this bill.
Are they giving us the honest reasons? Are they telling us the honest reasons why they're voting?
Chris, I'll tell you, I'm just not going to question the motives. I take my colleagues at their word. In the Democratic caucus, we've spent a lot of time on this bill, and each member has to reach their own conclusion. And if whatever reason they state is the reason that I think should be taken at face value.
Okay, here's a tricky question. Are people being told different things depending on their philosophies? For example, are the pro-lifers being told that in effect you probably won't have coverage of abortion services because it's going to be too onerous on the companies to have separate checks coming in, and it's just going to bother them to have to advertise this way or whatever? And other people being told, no, this is a pro-choice bill.
No,
are people getting different messages from Nancy Pelosi? She says there's no abortion. Do you buy the fact there's no abortion provided for in this bill? Even though you're a pro-choicer?
I'm pro-choice, and I believe that every member, whether you're anti-choice or pro-choice, can be confident that this bill is neutral on abortion, doesn't change current law at all, and ensures that we can have a separation between personal funds and government funds when it comes to abortion coverage.
Does this bill provide services for abortion? Does it in any way finance abortion, this bill?
It does not provide in any way federal funding for abortion, just like current law currently prohibits.
Okay, so it's consistent with Hyde.
It is. And at the end of the day, health care reform should not be about abortion. That's what we've been trying to get across.
Well, you can say it's not about it unless it provides for it. If it provides for it, it's about it. But you say it doesn't, so let's move on. Your point about the final decision-making as a whip, without giving away names of what you're negotiating with, but you can probably figure it out by looking at the list. What do you think is going to decide whether you get to 216 or not between now and Sunday? What will be the critical voting issues, as we say, to decide members?
Well, I think the members that are still making their decision are really the members that cost control is the most significant issue for them. And the CBO score that came out today that shows that we get a $138 billion reduction in the deficit, that we preserve Medicare for an additional 9 years and get a significant 1.4% savings in Medicare every year in this legislation for the first 10 years. Those are the kinds of things that are going to move those members, and that at the end of the day, we're going to be able to get to that magic 216 that we're going to need.
Thank you so much. Congresswoman Debbie Wasserman Schultz, who's out there getting the votes for the president and the speaker.